This is Where We Live from Connecticut Public Radio. I'm Catherine Shen. In his first week in office, President Donald Trump made big changes to public health. Already, he's announced that the U.S. would withdraw from the World Health Organization, though he said he'd reconsider it. The Trump administration has also put a freeze on public communications and meetings for several federal health agencies, including the National Institutes of Health. Both the WHO and the NIH are key players within public health, everything from preventing infectious diseases like COVID-19 to improving the overall health and wellness of our communities. Today, we'll hear what these changes at the national and global level might have for public health here in Connecticut. Joining us today in studio is Connecticut Department of Public Health Commissioner Manisha Juthani. Commissioner, welcome back to Where We Live.
Thanks for having me, Kat.
And listeners, let us know if you have any questions about the future of public health. We would love to hear from you. Give us a call, 888-720-9677, or find us on Facebook and Twitter at Where We Live. So, Commissioner mentioned just a few things at the top of the hour about what's been happening to public health in the past week. What's your immediate reaction to the Trump administration's decisions?
I think coming into this week, we knew that changes were going to be afoot. And we were trying to think through and plan for what changes might come. But honestly, you can never be fully prepared for what changes might occur. What I would say through the last week is that we know we've had a pause in communications from health and human service agencies. And as a state health department, we get a lot of funding from the CDC, from the EPA, from HRSA. These are a variety of different federal agencies that we get funding from. So that has been notable, but we've also been told that that is going to be temporary until February 1st. So we are in a little bit of a holding pattern, and we readdress our priorities, honestly, on a daily basis at this point, as we get information just like everybody else is and are trying to recalibrate and figure out how we will respond in short order. But what I want the residents of Connecticut to realize and understand and know is that although we do get a lot of funding from the federal government, most of our public health authorities are either at the state or local level. My job is one appointed by the governor. People that are hired by state government are hired by the state, and our functions in the state are largely for us to do in the state. And so we are continuing to do those jobs to make sure that we can try to keep people healthy and safe in the state of Connecticut, and we'll continue to do so regardless how the federal landscape continues to change.
Well, and as you're maneuvering that, and you mentioned the communications pauses with various different agencies, what does it actually mean, and what are the potential impacts when those communications are paused?
One example of that is that the CDC's MMWR, it's the Morbidity and Mortality Weekly Report. It is published on a weekly basis. It lets us know about new and emerging threats that the CDC may be investigating or reporting out on. And some of them are more things that are chronic diseases, even things like diabetes or hypertension, obesity, things that might be things that are being investigated over longer periods of time. But they are the scientific way that they communicate with the public health community about new things that are happening. We can think back to landmark MMWR reports around HIV, for example. That was not published last week. That was notable because that's something that hasn't happened in many, many, many decades. So again, we don't know what we don't know. But what I can say is certainly what's happening in Connecticut, we do have eyes on. So in the way that we partner with other states, the way that we partner with the federal government, some of that is where we may have less eyes on. And it is my hope that the pause, as they have said, would be temporary till February 1st will in fact be the case, and hope to see a resumption of communications after February 1st.
Well, and I also want to talk about there are many, many organizations involved. Whether or not this pause happens, we just threw out a lot of acronyms. We got the CDC, the EPA, we mentioned the NIH earlier, WHO. Could you give us a breakdown of what these organizations do and how do they work together?
So The CDC, as an example, is our main public health agency for the country. And they do research, they do investigations, they collect data, they help us have eyes on when new and emerging things are happening around the country. They have a lot of subject matter expertise that help us be able to implement things on the ground. And it can be on things that we know. For example, the origin of the CDC was around malaria. And so in a malaria outbreak, and how do you get that under control? So that is how it originally started. So all things infectious diseases, most certainly we rely on the CDC. But there are also things related to, for example, the opioid crisis that we have in our country. And one of the main foundations of public health is that we first define a problem. We then identify how to measure the problem. We identify interventions that might reduce or make a dent in that problem, and then continue to measure it going forward to see, did those interventions make a difference the way we thought they would, and recalibrate, readjust, and continue moving forward on any given problem. The CDC is doing that for any sort of problem that we can think of, whether it be suicide crisis, whether it be opioid use, whether it be H5N1, whether it be Mpox, whether it be a litany of other public health problems we have in our society. So we do rely on them for that expertise. And a practical consideration, as an example, is there are certain things that we can test at our state lab, but when we can't, we send samples to the CDC to get that kind of expert testing for certain diseases, as an example. So that's just one example of one agency, as the CDC. The EPA, which is the Environmental Protection Agency, as the health department, we have the purview of safe drinking water under us. And so whether it's keeping toxins out of water, whether it's keeping infectious pathogens out of water, whether it's keeping lead out of water, there could be any number of things. Again, we rely on EPA funding to be able to help us execute on that mission here in the state so that when people turn on the tap, they can feel confident that that water is safe. And so we rely on EPA partners, one, for technical guidance, but also for funding to be able to hold through on that regulatory authority. A third example would be CMS, the Centers for Medicare and Medicaid Services. That funds Medicare, it funds Medicaid, it funds our surveyors who we send out to nursing homes, who we send out to hospitals to ensure that safe and quality care is being administered in our healthcare institutions. And it's that regulatory authority to ensure safety in institutions that people go to receive healthcare and that they can rely on that. That is being funded. We are the agents of CMS. Our surveyors are the agents of CMS who are going out on the ground to ensure that these facilities are safe. And so you can see how the impact of federal funding and of federal collaboration is critical, but at the same time, there are many things that we can do on our own. So it's sort of balancing what can we do today and tomorrow, and we're taking it one day and one step at a time.
Well, and the fact that I think you broke down 3 different organizations, and that's just 3 of many.
That's
Clearly,
right.
there's so much interconnection here, and I think the impact is a lot wider than maybe we understand, just because this is not what we do on a daily basis. And certainly, I think the public has learned so much about public health over the last couple of years because of the pandemic and et cetera. And especially when it comes to vaccinations. And so we've learned over the last couple of years that Robert F. Kennedy Jr. is President Trump's nominee for the U.S. Secretary of Health and Human Services. So he's been an anti-vaccine activist for years and now could potentially lead the nation's biggest health agency. So if he's confirmed, what might that mean for what the agency prioritizes?
So a few things I would say. First of all, it's up to Congress to decide whether he is going to be confirmed. And we share a goal of keeping Americans healthy. And whenever we have to work with federal partners, we do want to find common ground where we can work together and leverage important things that we're all trying to accomplish for residents of this country and of this state. Having said that, vaccines are by far one of the most remarkable scientific and public health interventions that we as a country and as human beings have been able to do. And in the state of Connecticut, we have childhood vaccination rates that are higher than ours were pre-pandemic. Every state in the country had a drop-off in vaccinations when it came to children, particularly in the pandemic. But we have rebounded and gone even further in advancing uptake of vaccines and showing that the Connecticut public understands this public health intervention and accomplishment. And we as a health department are going to continue into leaning into those recommendations and trying to help people understand and tease out misinformation, disinformation from science as we see it. And I understand that that's a challenge for people. There's so much information out there, and it's hard to know what's real and what's not. And so what I've been trying to do for the last 3 years is make the Connecticut Department of Public Health a place where people can turn to try to get answers when they don't know what to make out of information that they're seeing. And vaccinations are certainly something that are core to our mission, and they're core to keeping people healthy in the state of Connecticut. So we will find common ground to work with all federal partners, but vaccinations is one thing where we as a state have shown that we believe in it as a public health intervention and as a way to keep people safe and healthy. And the public has believed in it. And we will continue to do our part to do what we can to educate people, to make vaccines available, and to help people through that process of understanding how to navigate those important health decisions.
Well, I have two sort of quick follow-ups based on everything you just said right now in terms of vaccination, especially with children. Just this week, I want to share that the American Academy of Pediatrics did put out a statement on vaccinations, talking about the proliferation of online misinformation about vaccines and increasing outbreaks of vaccine-preventable illnesses among children. So very similar to what you were just sharing with us, Commissioner. So can you talk about, how do you approach addressing some of these concerns? As you mentioned, there's so much information out there. Where does one start to make sure that they do get their facts straight? And I got a question from a listener that I'll get to after this.
So I think for individual people, starting with your own doctor is somebody who is certainly a trusted person in your life. Starting out with the doctor who takes care of your child. And as you said, the American Academy of Pediatrics, this is a group that helps organize and educate people in the profession, and utilizing them as resources, and certainly us as the local health department to be able to help you navigate those decisions. Your local health department within your own community, whether it's a department or a district, whether you're part of a health district. We have 59 local health departments and districts that report to the Connecticut Department of Public Health, and we all collaborate and work together. I think those are some on-the-ground, practical, right here in Connecticut resources that can help you in terms of navigating some of that. And one of the things that I like to remind people about is, we all are here to be able to help inform those decisions. It's hard when you're looking online or on various apps or various different media sources and you don't know what to make of what. But I think if you lean into some of those sources, those are good places to start to be able to help answer your questions. And we have people that are working in communities to be able to help identify pockets where there may be misinformation, disinformation, sometimes particularly in certain ethnic communities, or certain ideas are being proliferated in certain subgroups within our state, and working with local health departments to identify where those pockets may be and where we can go in to be helpful, to be able to help educate and bring people along. Really, at the end of the day, people are trying to keep themselves and their families healthy and happy. And seeing and meeting people where they're at, trying to understand their perspective, and then try to bring information in a way that can hopefully resonate with them to make those best decisions is all we can do to try to help and advance those missions.
Well, and very much related to everything that we were just talking about. I got a quick question from Kevin on Facebook who asks, how can we ensure that vaccination requirements for public schools, daycares, et cetera, aren't undermined?
Well, we have certain laws that are in place right now, and legislative session is afoot right now. And there are laws being proposed to pull back some of those types of interventions. I would encourage you as a listener and as a constituent to make your voice and your perspective heard by your legislators. So when they're representing their constituents, they hear not only the minority of people in our state who may want to roll back some of these interventions, but they also hear from the people who actually want to keep them in place. And I think that's really important. I think if you feel like you believe in some of these things, let the people representing you know that so that they can advocate for positions that currently exist. Connecticut is one of 4 states that does not have a religious exemption for vaccines. That was repealed in 2022 in the state of Connecticut. And in fact, we see some of our rise in vaccination rates in the state because, or I think might contribute to the fact that we don't have a religious exemption anymore. We do have those in the state who want to bring that back. And again, as somebody who lives in this state, if you like what you see in your state government, if you like the rules that you see, whether it be in daycares or schools, let the representatives, your senators, your representatives who represent your districts know that, so that they are not only hearing from the people who don't like the way things are right now.
Well, thank you so much, Kevin, for bringing that question for us. And right now, another issue that's been top of mind, I think, throughout the states and including our own, is there is concern over the rise of cases of bird flu in our state and beyond. So flock owners are being told to take precautions to prevent the spread of avian flu. Can you give us an update on what we're hearing here in Connecticut?
Absolutely. So avian flu, or H5N1, which is the one that we are seeing most right now, is certainly in our wild bird population. And that's where it really starts. It starts in the wild. It's been circulating in the wild for many, many, many years. But we're seeing more dead birds. And when you see, let's say, 5 or more wild dead birds, that is something that you want to alert our state organization called DEEP. So we have 3 state organizations that deal with avian flu, or H5N1. DEEP deals with the wild birds because they deal with the environment. And if you see 5 or more, reporting that to them is something that they can at least get eyes on. Are we seeing more dead birds popping up around our state? When the flocks have, whether they be pets, whether they be chickens, let's say, that you keep in your backyard, or whether they be actually the farmers who are maybe mass producing eggs for and the like, when they have interaction with the wild bird population, this is where there is the opportunity for H5N1 to go from the wild birds to poultry, as an example. And unfortunately, that's where we have seen some of the farms have had to go through situations where birds had to be euthanized because, unfortunately, it is almost 100% fatal of a virus for that population. And so it's actually a humane way that they deal with that. So that's our Department of Agriculture. And so, again, if you have a pet, whether it be bird or whether even, let's say, a household cat, because we have seen cats that have been infected with H5N1, you want to contact our state vet. So if this is an animal you take care of, you want to contact our state vet, who is through our Department of Agriculture. And ctstate.vet@ct.gov is a way to be able to contact them because they can help you navigate what to do if you have a sick pet. But if you have a sick pet, I really encourage you to stay away from the sick pet to the best you can. Because what we as the Department of Public Health are trying to do is prevent human infections, which we have not seen any human infections in the state of Connecticut. Many people have heard of herds of cows that got infected, and there have been 16 states where there were herds of cows that were infected. We did not have any, to be clear. In the state of Connecticut, we have not had any cows that were infected. But there were human beings that got infected, farm workers, from those cows directly. We have not had any human beings infected. We want to try to prevent that from happening, which is why I'm encouraging people to contact their vets if they notice that they have any pets that are infected. And again, the major reason for that is we do not have any evidence of human-to-human transmission in the United States, but we also do not want to create the opportunity for the virus to learn how to do that. So our focus in the Department of Public Health is doing the messaging to the people because that's what's in our purview. But we also recognize that we have to collaborate with DOAG and DEEP, the two other state agencies that deal with H5N1, either in the pets or farm animals or in the wild birds, so that we reduce the chance as much as possible of having a human infection and try to prevent the opportunity for the virus to learn how to accomplish person-to-person spread.
Well, and so many things on the list that we're concerned about and following through as we keep this conversation going and the messaging across. And another thing that we've been seeing, I think we've all been seeing, is there's been an increase in hospitalizations and emergency department visits because of respiratory viruses like COVID-19, influenza, or RSV. And that's according to recent data from our Department of Public Health. So with that, with everything going on, what would you want residents to know about protecting themselves from these viruses?
So I think people have heard me say this before, but we've got these three viruses, COVID, RSV, and the flu. All are three that have vaccines to prevent them. RSV, the recommendation is if you're 75 and older, that you should absolutely get it. If you're 65 and older, the recommendation is only if you have certain medical conditions. But for COVID and flu, the recommendation is if you're 6 months and older to get a vaccine. Now, the season is well underway. It's honestly not too late to get vaccinated against flu and COVID anyway, because what we've seen is that all three of the viruses are still higher than they were, let's say, in the fall, except for COVID, which has kind of been around all year long. But flu really has taken off, and that is our number one right now. It does seem like we're starting to turn the curve a little bit in that sort of epidemic curve that people have gotten used to seeing, a virus going up and down. But again, that doesn't mean that there's still not a lot of virus out there and that you're still at risk, particularly for our adults 65 and older. But with each increasing decade of life, 40, 50, 60, 70, and 80 for sure, this is where we're seeing the bulk of our hospitalizations and unfortunately deaths as well. And so it really is not too late to get your vaccine, but particularly for COVID and flu, and especially if you're older, if you get tested early in the course of your disease, you can also get treatment. So that's the other reason to be very aware of these viruses, because the mechanism in which we really deal with these viruses is vaccination is prevention, but treatment if you do get sick, and as early as possible getting treated. And then lastly, of course, staying away from others if you're sick, because as we've seen in our schools in particular, we've had many schools that have had flu A outbreaks that are ongoing. And that's because sometimes kids are coming to school sick and making themselves sick, making their teachers sick. And I think that's a way that we can help blunt this as we go through the rest of the season.
And we'll be continuing this conversation after a quick break. You've been listening to our Department of Public Health Commissioner, Manisha Juthani. She'll be staying with us. So let us know if you have any questions about the future of public health. We definitely want to hear from you. And coming up next, we also are going to talk about the planned U.S. withdrawal from the WHO, the World Health Organization. And we're also going to be speaking with a Connecticut member of the WHO task force. Give us a call if you have questions, 888-720-9677, or leave us a comment on Facebook and Twitter at Where We Live. This is Where We Live from Connecticut Public Radio. I'm Catherine Shen. Today, we're unpacking the Trump administration's recent changes to public health and how it's impacting federal health organizations, including one executive order we saw last week. President Trump announced that the U.S. would be withdrawing from the WHO, or the World Health Organization. With us still is Connecticut Department of Public Health Commissioner Manisha Juthani, and joining us now is Dr. Albert Ko, who's a physician and epidemiologist at the Yale School of Public Health. He was one of Governor Ned Lamont's chief advisors during the pandemic, and he's also a member of the WHO R&D Task Force for Zika virus and also the R&D Blueprint Working Group. Thank you so much, Dr. Ko, for joining us today.
Thank you, Kat, for the invitation to participate in the show, and also with my colleague, Commissioner Juthani.
Well, I was about to ask you, Dr. Ko, you've been listening to the conversation. Could you respond to what we've heard so far from the commissioner? Anything that jumped out to you?
No, I think, Commissioner Juthani, really hit on really key points with respect to the health and protection of the citizens of Connecticut. The first of all, that we have, I think what we've learned through the pandemic is good governance, and how good governance is essential to protecting citizens and also the most vulnerable in our communities. And I think her message right in the beginning about how that our government is here, our governor, Commissioner Juthani, the Department of Public Health, are here to protect the citizens of Connecticut, and that we are in charge of our own destiny in that sense. I think that was very important. I think the other thing that she hit on that was important is the threat of avian influenza. As Manisha mentioned, there hasn't been transmission to humans here in Connecticut. We definitely have it in birds, and we're just worried that the moment where this virus will mutate and then cause person-to-person spillover to humans and then person-to-person transmission. So we have to keep vigilant on that.
So it sounds like just stay as careful and be as vigilant and cautious as we can. And in addition to your work in the pandemic, we mentioned earlier that you are a member of the WHO various task forces, including the Zika virus. And these are groups that work on medical countermeasures for international incidences like the global pandemics that we've seen over the last couple of years, and certainly the last handful of years. And I think many of us have heard of WHO, but we might not know exactly how it works. Can you tell us a bit about what the WHO does and how does it work?
Yeah, so WHO, or the World Health Organization, it's an agency of the United Nations, and its mission is to improve health and well-being globally, protect people from health emergencies, such as the pandemic that we just passed through, with COVID, but also additional threats like avian influenza, monkeypox, and ensure universal health coverage. And it does so by setting international standards and providing guidance so that we're all speaking one language across different countries, coordinating international responses to health emergencies, and so that we avoid fragmentation of responses, getting each part of the world going different directions. And so it's a coordinated and effective response. And lastly, providing technical assistance to prevent diseases, important diseases such as tuberculosis. My father is a tuberculosis survivor. The WHO, has key programs in eliminating diseases like tuberculosis, so cases like my father won't happen again to many of the populations that still suffer these diseases.
Well, and we've heard so much about the organizations have a lot of collaborations with each other. And so with the potential of the United States withdrawing from WHO, can you talk about what kind of implications will that have? And would the U.S. consider partnering with other organizations if we do withdraw?
Yeah, so let me just start off with one example that hits close to home. Every year, Manisha, Commissioner Juthani, mentioned that we have seasonal influenza and we have peaks in the winter. The WHO plays a critical role, in coordinating laboratory surveillance. It has a laboratory network around the world, and it collects information to tell us in the United States, but also throughout the Northern Hemisphere and the Southern Hemisphere, what strains should go into making that vaccine each year. And that's a vaccine that saves thousands of lives and tens of thousands of hospitalizations in the US each year. By withdrawing from the US, from the WHO, the United States risks losing that critical information that WHO collects, coordinates, and distributes to member states in order to make medical countermeasures, such as the influenza vaccine. So certainly there's large scale implications, direct implications. There's also indirect implications that are important. How are we going to, you know, keep these collaborations and protect ourselves here in the United States, but also people abroad? If we don't if we don't oblige to the treaties, and how we're going to guarantee that countries are going to share strains, sequences that we're going to make the next vaccine against the next cause of a pandemic.
And with that in mind, too, President Trump has said he'd reconsider joining the WHO again. So, how likely is that going to happen, you think?
Kat, that's a question that I can't really say. Of course, many of us in the public health world, realize how our lives have changed. We live in a very highly connected, globalized world. Diseases. I was working in Brazil in 2015 during the Zika pandemic. We saw how that spread like wildfire from Brazil throughout the Americas all the way to Florida. We had cases of Zika here in Connecticut. We saw how COVID spread widely. And if we do have a threat, whether it's avian influenza or the next infectious disease that comes down the line, we're really concerned about how we're going to be able to mount a global response that protects people abroad, but also protects us from getting, from that threat spreading to the United States.
Well, and earlier we've been talking too about other changes like halting public communications with several health organizations nationally, including the NIH. What are you seeing on your end? I know Commissioner Juthani mentioned earlier this pause could be temporary, but are you seeing an impact already?
Yeah, so certainly, and these of course are creating fear in the research community. I'll come back to that in a second, but certainly, there have been several executive orders that are raising concern. One is the withdrawal of CDC personnel in key critical missions, global missions that are coordinated by the WHO, such as polio eradication. I remember, I'm old enough to remember my Boy Scout troop master, who was had a permanent limp because of polio. I remember, from my trips to Korea, seeing people in the streets, beggars, afflicted with polio. And the U.S., not only provides personnel and staff for these key kind of, missions that protect not only the world, but protects us from diseases like polio coming back, but it also provides leadership. And the withdrawal of the U.S. in a key organization from WHO really takes us out of that room to really guide how we're going to protect ourselves as well as protect the world.
Well, and there are several pauses that we were talking about today, and you mentioned it just a little bit earlier, because as of this morning, the White House has paused federal grants and loans. So how is this going to impact the health and research community? Might we see pauses on research and education in our state?
Yeah, so today, as you mentioned, Kat, there was an order from the Office of Management and Budget, placing a pause on grants and loans. And this has widespread implications in the trillions of dollars, not just in health and in research, but in education, our schools, our communities, that benefit from these grants and loans. But let's take it a little bit home. I'm a researcher from the Yale School of Public Health and the Yale School of Medicine. And just thinking about Connecticut, we get $752 million in grants awarded to Connecticut each year to our research community. That's more than 8,000 jobs. And that's $1.6 billion in economic activity just for the state. And thinking about more importantly, I look at my colleagues at the Yale School of Public Health and Yale School of Medicine doing pioneering work, personalized treatment for lung cancer, new therapies to treat blindness in the elderly, using AI to identify who's at risk, most risk for heart failure, preventing Lyme disease and dengue with novel strategies. All of those are going to be paused. And this is not like an on and off switch that you can flip back on. When you pause it, people's jobs are at risk. The impact on the research is and the benefits that it can give to society can't come back easily and can't be turned back on.
Commissioner, did you want to respond to that?
I just wanted to highlight also that, the NIH funds academic institutions. And so the impacts that Dr. Koh is talking about at the academic level is one significant impact. At the state level, a number of the agencies that I talk about, 80% of our funding is through the federal government, also through grants and loans. And so the academic institutions are doing a lot of the novel, cutting edge new science. And we as state agencies, and particularly as the public health agency, are doing the implementation of that work. Mm-hmm. So when new things come out and they become part of practice and we get grants to fund them, it's very hard to undo things once you stop them. Pause is one thing, but what we're hoping for is that in short order, we figure out which way this is going. And that's part of what we're planning for and trying to figure out what's going to happen so that we can continue to sustain services and implementation to the best of our ability. But of course, money is a significant challenge in that. And so just to help people understand in Connecticut, different institutions are funded in different ways in the state. The academic ones might be very reliant on NIH, maybe also CDC. But our government is very highly also dependent on these federal agencies, and even if you think about things like Department of Transportation, roads and bridges and all the things that we've done over the last several years, a lot of that is through federal infusion and investment of funds.
Right. And Dr. Koh, would love for you to respond to that real quick, especially with the idea of potentially stopping new sciences in colleges.
Yeah, I think, Manisha is spot on. Certainly, and I think we're still getting our heads around what is really going to happen, not only just universities, but as Manisha, obviously as commissioner of the Department of Public Health, how this is going to affect our daily lives. I'm thinking about the daycare centers, many of them which receive federal grants. I'm thinking also about our schools and our churches and temples and synagogues that are going to be infected and whose programs are dependent. Many of them are dependent on federal grants and loans, and so this is going to has potential, key implications on our social life, and I think all of us we're in a period of uncertainty about what that means.
Well, we've covered a lot of ground today, and with just a couple minutes left, I would love to get sort of both of your final thoughts for our listeners. I think, Commissioner, we're going to go with you first. What do you hope our listeners take away from our conversation today?
Two main things. First, that we are still Connecticut strong. We still have our government. I'm grateful to have this job in this state where we are committed to protecting health and safety for the residents in this state. And we're going to do the best job we can to keep fulfilling on that mission. And also to recognize that we're in a period of uncertainty. And every day I wake up with new news and try to figure out how we're going to navigate the day. And I'm hopeful that the Trump administration that has chosen to pause certain things will come in short order to figure out whether by February 1st we can resume certain communications. Some of these pauses in grants, I hope that we are able to remove those pauses and move forward, but to recognize that we're in a period of uncertainty, but we're in a period of uncertainty together. And if we lean on each other and recognize that our core values and mission in Connecticut have not changed, that we will get through this together.
And Dr. Ko, as you navigate the uncertainties as well, any priorities you'd like to share with our listeners or final thoughts?
Yeah, I go back to one of my favorite politicians, Tip O'Neill, who is Speaker of the House. And Tip O'Neill said his adage was, all politics is local. And politics, public health and our well-being is like politics. It's a local phenomenon. It's based on our communities. It's based on our families. But we are living in a different world than Tip O'Neill back in the 1970s. We're living in a highly connected, globalized world. What happens in Africa, or what happens in Korea, where my parents had come from, what happens in Brazil, where I've worked in the last 30 years, affects us here in the United States and in Connecticut. And that's the work that many of us in the school, public health have been working on in the last 30 years about how do we make solutions in a globalized world. And we have to think about the implications of we're withdrawing from that globalized world, and the fact that those implications will decrease, reduce the capacity, and it's not something that we can just build back up again.
Well, thank you so much for sharing your thoughts and expertise with us today. You've been listening to Dr. Albert Ko, who's a physician and epidemiologist at the Yale School of Public Health, as well as a member of the WHO Research and Development Working Group. Thank you so much, Dr. Ko, for being with us today.
Thank you, Kat. Thank you for the invitation.
And also with us was Connecticut Department of Public Health Commissioner Manisha Juthani. Thank you so much for giving us your time, too.
Always a pleasure to be with you, Kat. Thank you.
And coming up, Connecticut Public's senior health reporter responds to what we just heard. And we want to hear from you, too. Let us know if you have any questions when it comes to public health. Give us a call, 888-720-9677, or leave us a comment on Facebook and Twitter at Where We Live. This is Where We Live from Connecticut Public Radio. I'm Catherine Shen. This hour, we're unpacking what national changes to public health could mean here in Connecticut. We just heard from Connecticut Department of Public Health Commissioner Manisha Juthani and Dr. Albert Ko from the Yale School of Public Health, who's also a member of WHO Research and Development Working Groups. And joining us now to break down what we just heard is Sujata Srinivasan, who's our senior health reporter at Connecticut Public. Sujata, always a pleasure having you on.
Morning, Kat.
And so you've been following along the conversations with Commissioner Juthani and Dr. Ko. Anything that jumped out to you that you want to respond to?
Well, the takeaway really is that science is not partisan, and diseases don't really care about borders. And it's important for all of us listening to this conversation to lean into trusted sources. Now we have the Connecticut Commissioner, Department of Public Health, who talks about leaning into the department's sources of information, leaning into Connecticut's own health districts for information, to focus on biosecurity. I mean, with the astronomical prices of eggs, more people, we are hearing through our reporting sources, are now developing backyard flocks. So if you're ordering chicks via, mail, please look into your biosecurity details and speak up. If you like the laws we currently have on vaccines, as Dr. Juthani said, it's important that lawmakers should know.
Well, sort of a twofold problem to what you just shared is, compared to other states, how is Connecticut situated, you think, to handle potential cutbacks to federal funding to public health?
Connecticut, like every state in the U.S., leans heavily into federal funding. It powers, it rockets the engine of our basic science research. I mean, and this morning, the NIH grants being paused was concerning to a lot of people in the medical community, as Dr. Ko and Dr. Juthani pointed out. Yale in 2024 got a $645 million NIH grant, $60 million to the UConn School of Med, DPH, Hartford Healthcare, and all of these excluding the bioscience organizations, the companies in Connecticut. So that's one part that's being hit. And then, of course, the GOP talks at the federal level about scaling back on Medicaid funding to finance deficits, and also, potential caps on Medicaid, removing incentives, match grants and so forth on Medicaid expansion. So all of that is a concern. But we've been, in the last several days, as much as we've been inundated with executive orders, which really are setting the tone of the government and intention. All of this has to be voted in the Senate, and it might take months before we get to, what the outcome is. The intention has been set, and Democratic public health officials that I've been speaking to have repeatedly said, even before President Trump's administration took over, that they are looking into put what they call safeguards in place. So Senate Bill 7 is a strong example of financial safeguards. And one of that would provide, an initial proposed amount, fund would provide $30 million. And it would be used to establish an emergency public health financial safeguard fund. And that would continuing to finance the DPH during emergency response situations, public health needs. There's also a public health safeguard fund. So these kinds of bills are being proposed. They should attract bipartisanship support, given the many vested interests we have in the state, in towards the well-being of our people here.
Well, then, really quickly, about a minute here. An area we haven't talked on really is health insurance. Do you think there's going to be any changes there under this administration?
Well, with regard to public insurance, definitely. Because that's how the conversation so far has been. The financing and the deficits control is directly linked to Medicaid spending. So if there's a cut of $2.3 million in Medicaid, it's impossible not to feel the trickle-down effects in Connecticut. Imposing work requirements or repealing incentive for states to newly adopt the Medicaid expansion. And we did really well with postpartum expansion of care in Medicaid in Connecticut, and especially with the maternity deserts that we are now seeing, especially in rural areas of the state. The expansion program has been documented to show positive outcomes, maternal health outcomes of the babies here.
And about 30 seconds here, but anything you're prioritizing for your reporting over the next coming weeks?
So we're going to be watching, but not, watching and waiting the tone of the executive orders, because they don't necessarily mean that the change is going to happen right now. And we're going to see, where that goes. But at the same time, it's important to keep a tab on where we are heading with this. For instance, a lot will be revealed on Feb 5th. When the governor proposes the budget. So we'll know how these federal gaps might be, filled by state decisions.
Well, we'll certainly be following your reporting. Thank you so much. You've been listening to Sujata Srinivasan, who is our amazing senior health reporter here at Connecticut Public. Thank you so much, Sujata.
Pleasure, Kat.
I'm Catherine Shen. Today's show is produced by Tess Terrible. Our technical producer is Dylan Reyes. Download Where We Live anytime on your favorite podcast app. And thank you all so much for listening.